This is Dr. Stephen Harkins. Welcome to page 62 of Anatomy Coloring Book, Muscles of the Anterior Thigh. There are a number of muscles of the anterior thigh, long and powerful. You've heard of the quadriceps, the quads. That's effectively what we're talking about here, the quadricep muscles. But quad means four, so there are four separate quadriceps muscles, which we'll go over individually. But the most superficial muscle is the Sartorius muscle. We will make it in red. The Sartorius muscle is this long, slender muscle from the anterior superior iliac spine, origin right here, at the ASIS, the anterior superior iliac spine. And it runs vertically downward and across the thigh to the medial side and all the way down to our friend, the pes anserinus. And it's going to join the tendons of the gracilis and semitendinosus. Recall that semitendinosus is coming around from the back side. It's one of the hamstring muscles. And the gracilis is one of those adductors and actually a flexor. And so that is the Sartorius muscle. And here you can see it sort of flexing the joint and adducting and externally rotating the joint here. And you can see it here sort of wrapping around from lateral side to the medial side of the knee. So recall that the pes anserinus is on the tibia itself. So it crosses this muscle crosses two joints. It crosses the hip joint and it crosses the knee joint. And here it is at the pes anserinus as well. That's here. So it is a flexor of the hip joint in here, and it is also a flexor of the knee joint. That is the gracilis muscle. Excuse me, that is the Sartorius muscle. It flexes the hip and flexes the knee at the same time. And you can see why that's possible because of its unique position on the front of the leg and then wrapping around to the pes anserinus on the medial side. And you can see the leverage it has right here at its insertion point to pull the knee backward or pull the leg backward. You can see also why it has leverage to flex the hip forward. Next, the quadriceps muscles. Well, right down the middle of the quadricep muscle is this unique muscle called the rectus femoris. It is it's a strong muscle right smack in the middle of the thigh and connecting directly into this patellar tendon and which envelops the patella and encases it inside and then goes on to attach at the tibial tuberosity or the tibial tubercle. The origin of the rectus femoris muscle is right here at the anterior inferior iliac spine. Not the ASIS, but the AIIS. AIIS. So there's the anterior superior iliac spine here, and the anterior inferior iliac spine down here. So it's been cut away here so you can see these other muscles. but the rectus femoris, and rectus means straight in Latin, I believe. So it's a straight muscle, straight down the front of your thigh. And here it is, right down the middle of the thigh here. And it is also a flexor of the hip joint. It can also, and you can see why, similar to the Sartorius, you can see why it would, if it contracts in this way, it would flex and bring the knee upward, bring the whole entire hip, femur upward. Here you can also see why it is an extensor of the knee joint. Because of its connection to the patella here, it is going to straighten the knee. It's going to pull upward on that patella, and it's going to wind up straightening or extending the knee joint. So it has two functions. It, just like the Sartorius, can flex the hip joint and flex the knee joint. Well, the rectus femoris can flex the hip joint, and it can extend the knee joint or straighten out the leg on the knee. That is the rectus femoris muscle. Now the vastus lateralis muscle. Vastus lateralis, lateral means to the side, right? So the vastus lateralis muscle is this muscle on the side here, the side of the quadriceps. And it does not insert or originate on the pelvis, rather it originates on the femur itself. So here it is, it lies on top of the femur, and then it inserts into the patellar tendon and wraps around the patella and into the tibial tubercle. Here it is, the vastus lateralis. Lateral means side. So here's a side view, a lateral view, and inserting into the patellar tendon. Its job, like the rectus femoris, is to straighten the knee, extend the knee. It is also a knee extensor. That's the vastus lateralis. The vastus intermedius is deep underneath the rectus femoris here. And so we've cut away the rectus femoris to see the vastus intermedius. Of course, what does intermedius mean? It means in the middle, right? And it also originates on the shaft of the femur, the anterior femur, and then ties into this patellar tendon as well, and attaches at the tibial tuberosity of the tibia. The vastus intermedius. Now, final of the quadriceps muscles, the fourth and final, is the vastus medialis. This is the very popular muscle of the quads and the knee that you see. And when it's well developed, it's the muscle that kind of hangs over. You can see the medial knee, because it is so strong in athletes. And here it is on the medial side, and you can see the tendon coming in and joining the patellar tendon to insert at the tibial tuberosity or the tibial tubercle. And here it is inserting onto the patellar tendon. So all these quadriceps muscles, including the rectus femoris tendon, they all join together. These 1, 2, 3, 4, blue, green, orange, and blue, and dark blue. They all join in one tendon, the patellar tendon, and attach right here at the tibial tuberosity. All four quadriceps muscles. They join the patellar tendon, and where they have their insertion on the tibial tuberosity. Also known as the quadriceps tendon. The patellar tendon is known as the quadriceps tendon. Now, lastly, but certainly not the least, is the iliopsoas muscle. This is a kind of a strange muscle because it's massive, actually. Look where it begins as its origin. It begins all the way up in the lumbar spine on the vertebrae. At every level of the lumbar spine, it's got multiple attachments here, and then it runs down and attaches and inserts on the femur at the lesser trochanter of the femur. Here it is again, running downward from the lumbar spine, crossing the hip joint, crossing this hip joint right here, and inserting on the lesser trochanter of the femur. It is not shown adequately in these drawings because it is the most dominant. It's the biggest flexor of the hip. It flexes the hip joint along with the rectus femoris and along with the sartorius. But it is the most powerful of the three. And you can see it here, the thick muscle coming from the lumbar spine here and reaching down, and it's deep underneath. It's in your abdomen. It's on the posterior wall of your, it's on the anterior wall of your thoracic cavity, or of your abdominal cavity. And it's on the back of your abdominal wall, and it runs down and snakes through under this, the inguinal ligament. And here it snakes downward, downward, downward into this hip joint right here. So it would be coming down from the lumbar vertebra here, right? Reaching off of there, coming off these vertebrae down underneath the inguinal ligament, over the top, actually underneath these muscles right here. Let's see, underneath the rectus femoris and underneath the sartorius, to come out right here and grab this lesser trochanter right here. Also joining it is the Iliacus muscle. So it's actually called the iliopsoas for a reason, because there's a branch that comes from the iliac fossa here. The branches often meet the muscle here before it goes under and attaches to the lesser trochanter. So here it is. The iliac portion and the lumbar portion of the iliopsoas comes from all the way up here down and under the inguinal ligament and underneath the sartorius muscle, and attaches right here to the lesser trochanter of the femur. So you can see how it would be a very, very powerful flexor of the hip joint. And we'll draw it here as well. It would be branching off from the lumbar vertebra, strands of muscle, also branching from the iliac fossa of the ilium. So that the iliopsoas, and they would meet up here together and travel down and attach to the lesser trochanter of the femur to flex the joint, the hip joint, bring the femur upward. And what I've been referring to as the patellar ligament, or the patellar tendon, they're calling the patellar ligament. And that is this right here. I suppose since it attaches bone to bone, it attaches the patellar bone, this bone, this little sesamoid bone in here. Where is it? Right up here, yes. Attaches this bone to the tibial tuberosity right there. So that makes it a ligament technically, But most people would call that the patellar tendon. And so the patellar ligament or the patellar tendon. And that summarizes the muscles of the anterior thigh, page 62 of Anatomy Coloring Book. This is Dr. Stephen Harkins. Until next time.